Black nurse treated German POWs. They couldn't believe she showed them mercy. You have no business being in this ward, nurse. These are enemy prisoners, not patients deserving of your kindness. Every man bleeding on a hospital bed is my patient, Captain. That's what the Hippocratic Oath means. The words hung in the air of Ward C at Camp Ruston, Louisiana, on a sweltering August afternoon in 1944. Captain Walter Brimley stood with his arms crossed, his face red with indignation, blocking the doorway as Nurse Eula Mae Johnson held her ground. Behind her, through the wire-reinforced windows, 23 German prisoners of war lay in various states of injury and illness. Behind the captain, 2 military police officers waited for his orders, hands resting on their holstered pistols. Eula Mae didn't flinch. At 28 years old, she had faced far worse than an angry army officer. She had grown up in Jim Crow, Mississippi, earned her nursing degree against impossible odds, and watched 3 of her brothers ship off to fight the very men who now filled this ward. She knew what it meant to be told she didn't belong somewhere. "These men tried to kill Americans," Captain Brimley said, his voice tight. "Your brothers, your neighbors, and you want to treat them like guests at the Ritz." "I want to treat them like what they are," Eula Mae replied calmly. "Wounded human beings under my care." The tension in that moment was thick enough to cut with a scalpel. 3 German prisoners in the nearest beds watched the exchange with wary eyes, understanding enough English to grasp the confrontation even if they missed the finer points. One of them, a young soldier named Klaus Meyer who couldn't have been more than 19, held his breath, his bandaged arm clutched to his chest. But let's go back to how this all started. It was just 6 hours earlier when Eula Mae Johnson had first walked through the gates of Camp Ruston's medical facility, carrying her nursing bag and her official transfer orders. The morning had begun ordinarily enough. Eula Mae had reported to the main hospital building at 600 hours sharp, as she did every morning. The colored nurses' station was in the basement, separate from the white nurses' quarters upstairs, as was the custom in 1944 Louisiana. She had changed into her crisp white uniform, pinned her nursing cap to her carefully arranged hair, and reviewed her assignments for the day. "Morning, Eula," called Bessie Wright, another colored nurse who had become her closest friend at the camp. Bessie was 42, with kind eyes and hands that had delivered more babies than she could count back in her hometown of Shreveport. "You hear about the new assignment?" "What new assignment?" Eula Mae asked, checking her supply bag. "Head Nurse Patterson wants to see you in her office. Didn't say what about, but she had that look." That look, as both women knew, usually meant trouble of some kind. Eula Mae climbed the stairs to the first floor, where the white nurses worked, and knocked on head nurse Catherine Patterson's door. "Come in." Catherine Patterson was a formidable woman of 55, a veteran of the Great War who had served in France and had little patience for nonsense. She looked up from her paperwork as Eula Mae entered. "Nurse Johnson," she said, removing her reading glasses, "I have a new assignment for you, effective immediately." "Yes, ma'am. We've had an influx of German POWs at the camp hospital. Ward C is now dedicated entirely to prisoner patients. I need a nurse who can handle difficult circumstances with professionalism and discretion." Patterson's sharp eyes studied Eula Mae's face. "You've shown both qualities consistently since you arrived here 3 months ago. I'm assigning you to Ward C full-time." Eula Mae felt something tighten in her chest. Her oldest brother, Samuel, was fighting in France at that very moment. Her middle brother, Thomas, had been wounded at Anzio and was still recovering in a hospital in Virginia. Her youngest brother, Marcus, had shipped out to the Pacific just 2 weeks ago. "Ma'am," Eula Mae said carefully, "you want me to care for German prisoners." "I want you to care for patients," Patterson replied. "They're prisoners, yes. They're also wounded men requiring medical attention. The Geneva Convention requires we provide it. Can you do this job, Nurse Johnson?" Eula Mae thought about her brothers. She thought about Samuel's last letter describing the destruction he'd seen in a French village. She thought about Thomas's Purple Heart, earned when German artillery had torn through his unit. She thought about Marcus, whose ship was sailing toward islands whose names she couldn't even pronounce, where more German allies waited to try to kill him. Then she thought about her mother's voice reading from the Bible every Sunday morning in their small church in Hattiesburg. "Love your enemies. Do good to them that hate you." "Yes, ma'am," Eula Mae said. "I can do the job." "Good. Report to Ward C at 700. Dr. Morrison will brief you on the patients." Ward C occupied the eastern wing of the camp hospital, a long rectangular building with barred windows and a guard station at the entrance. When Eula Mae arrived, 2 military police officers stopped her immediately. "Where do you think you're going?" one of them asked. "I'm Nurse Johnson. I've been assigned to Ward C." The guards exchanged glances. "You sure about that? These are German prisoners." Eula Mae showed them her assignment orders. The guards read them slowly, then reluctantly stepped aside. Inside, the ward looked like any other hospital ward Eula Mae had worked in, except for the guards posted at both exits and the bars on the windows. 23 beds lined the walls, most of them occupied. The men in those beds ranged from teenagers to middle-aged soldiers. Some had bandages on their arms or legs. Others had more serious injuries, amputations, severe burns, shrapnel wounds that had required surgery. Dr. James Morrison, a tired-looking man in his late 40s, met her at the nursing station. "You must be Nurse Johnson," he said, shaking her hand. "Thank God, we've been short-staffed since this ward opened 2 weeks ago." He didn't seem to notice or care about her race, or if he did, he was too exhausted to show it. "Let me walk you through the cases." They moved from bed to bed. Dr. Morrison explained each patient's condition in clinical detail. Bed 1, Corporal Hans Richter, compound fracture of the left femur. Bed 2, Private Wilhelm Bauer, second-degree burns across 30% of his body. Bed 3, Lieutenant Franz Vogel, amputation of right leg below the knee, recovering from infection. The German soldiers watched Eula Mae with expressions ranging from curiosity to hostility to fear. Some of them had never seen a black person before arriving in America as prisoners. Others had been fed Nazi propaganda about racial inferiority, and now here was a black woman in a nursing uniform, clearly in a position of authority over them. When they reached Bed 8, Dr. Morrison lowered his voice. "This one's been difficult. Private Klaus Meyer, 19 years old, took a bullet through the upper arm during capture. The wound was infected when he arrived, and we had to operate. He's been running a fever on and off for the past week. Refuses to take his medication half the time." Eula Mae looked at the young man in the bed. Klaus Meyer stared back at her with blue eyes full of suspicion and pain. His blonde hair was matted with sweat, and his face was pale except for 2 fevered spots of color on his cheeks. "Why won't he take his medication?" Eula Mae asked. "Language barrier mostly. He speaks a little English, but not much, and I think he's afraid." "Afraid of what?" Dr. Morrison shrugged. "Us, this place. Being a prisoner, pick your poison. Half these boys are terrified, and the other half are too proud to show it." Eula Mae nodded. She understood fear. She had grown up with it as a constant companion, fear of saying the wrong thing to the wrong white person, fear of being in the wrong place at the wrong time, fear for her brothers overseas. Fear was a language everyone spoke, regardless of what country they came from. "I'll handle it," she said. For the rest of that first day, Eula Mae threw herself into the work. She checked vital signs, changed bandages, administered medications, and updated patient charts. She worked efficiently and professionally, speaking to each patient with the same calm respect she would show anyone under her care. Most of the German prisoners didn't know what to make of her. Some refused to look at her directly. Others watched her every move with suspicious eyes. A few seemed genuinely confused by her presence. But Eula Mae had learned long ago not to wait for permission to do her job. She simply did it. By mid-afternoon, she noticed Klaus Meyer's fever had spiked. His bandages needed changing, and he was due for his antibiotic dose. She approached his bed with her supplies. "Time for your medicine," she said clearly. Klaus turned his face away. "Private Meyer," Eula Mae said, maintaining her calm tone, "your infection will get worse if you don't take this. I know you don't want to be here. I know you're scared. But this medicine is the only thing standing between you and sepsis will kill you faster than any bullet." Klaus still wouldn't look at her, but his hands, gripping the thin hospital blanket, trembled slightly. Eula Mae pulled up a chair and sat down beside his bed. This was against protocol. Nurses were supposed to remain standing, to maintain professional distance. But something in the young man's rigid posture reminded her of her youngest brother Marcus, trying so hard to be brave before shipping out. "How old are you?" she asked softly. "19," Klaus muttered, then in halting English, 19. "My youngest brother is 20, Eula Mae said. "He's somewhere in the Pacific right now. I haven't heard from him in 2 weeks, and every day I don't get a letter, I imagine the worst." She paused. "Does your mother know where you are?" Klaus's jaw tightened. Then barely audible, "No." "Then let me help you get well enough to write to her," Eula Mae said. "Let me change these bandages and give you this medicine, and tomorrow we'll see about getting you some writing paper." Klaus finally turned his head to look at her. His eyes searched her face as if trying to solve a puzzle. "Why?" he asked. "Why you help me?" Eula Mae considered the question. She thought about all the easy answers she could give. "Because it's my job. Because the Geneva Convention requires it. Because Dr. Morrison told me to." Instead, she told him the truth. "Because you're somebody's son," she said. And somewhere in Germany, your mother is wondering if you're alive or dead, just like my mother wonders about my brothers. I can't help my brothers from here, but I can help you, so that's what I'm going to do." Something shifted in Klaus's expression. The suspicion didn't disappear entirely, but it cracked just enough to let something else through. He gave the smallest nod. Eula Mae changed his bandages with gentle efficiency, cleaning the wound and applying fresh dressings. The infection looked angry and red, but it hadn't spread significantly. When she offered him the antibiotic pill and a cup of water, he took them without protest. "Thank you," he said quietly in English. "You're welcome, now rest." As the afternoon wore on, Eula Mae noticed other patients watching her interaction with Klaus. Word seemed to spread silently through the ward. By the time she reached bed 15, where a middle-aged sergeant named Otto Schneider lay with a shrapnel wound in his shoulder, the man actually made eye contact with her. Eula Mae set down her medication tray with careful precision. She looked at Klaus Meyer, whose eyes were wide with something that might have been concern. She looked at Otto Schneider and Franz Vogel and all the other patients who were watching this confrontation. Then she picked up her nursing bag and walked toward the door, her head high, her shoulders back. But Captain Brimley wasn't finished. "And let me make one more thing clear," he called after her. "These men don't need your mercy. They don't deserve it. They're the enemy, and you'd better start treating them as such." Eula Mae paused at the door. She turned back to face him. "Captain," she said, "I don't treat them with mercy because they deserve it. I treat them with mercy because I do." She left the ward before he could respond. The walk to head nurse Patterson's office felt like the longest of Eula Mae's life. Her hands were shaking, and she could feel tears threatening at the corners of her eyes, but she refused to let them fall. Not here, not where anyone could see. She knocked on Patterson's door. "Enter." Catherine Patterson looked up from her desk, took one look at Eula Mae's face, and sighed. "Captain Brimley already called. Sit down and tell me your version." Eula Mae sat and recounted the entire confrontation, leaving nothing out. When she finished, Patterson was quiet for a long moment. "Did you really tell him your place wasn't subject to his approval?" Patterson asked. "Yes, ma'am." "And did he really tell you to remember your place?" "Yes, ma'am." Patterson removed her glasses and rubbed the bridge of her nose. "Eula Mae, you're putting me in a difficult position. Captain Brimley is a senior officer. He has authority over camp security. And you? Well, you're a colored nurse who just talked back to a white captain." "I know, ma'am. In 1944 Louisiana, that's not just insubordination, it's—" Patterson trailed off, but they both knew what she meant. It was dangerous. "Ma'am, I didn't mean any disrespect, but those patients need consistent care. Private Mayer's infection is just starting to respond to treatment. If we change nurses now—" "I'm not changing nurses," Patterson interrupted. "You're the best nurse for that ward, and we both know it. But you need to understand something. Captain Brimley will be looking for any excuse to remove you from Ward C, any excuse at all. So from now on, you need to be perfect. No sitting beside patient beds, no conversations that aren't strictly medical, no giving him ammunition." Eula Mae felt relief wash through her. "Yes, ma'am, I understand." "Good. Now go back to your quarters and compose yourself. Return to Ward C tomorrow morning at your regular time. And Eula Mae?" "Yes, ma'am. What you said about mercy, that was the right thing, but the right thing and the safe thing aren't always the same. Be careful." That night, Eula Mae lay in her bunk, staring at the ceiling. Bessie had already fallen asleep, her soft snoring the only sound in the quiet room. But Eula Mae's mind wouldn't stop racing. She thought about Captain Brimley's words. She thought about Klaus Meyer's face when Brimley had dismissed her. She thought about her brothers and what they would make of all this. Samuel, the oldest, would probably tell her to keep her head down and do her job. Thomas, the middle brother, would be angry on her behalf but practical about the realities of the situation. But Marcus, her baby brother with his idealistic streak, Marcus would probably tell her she was doing the right thing. She pulled out Marcus's most recent letter and read it again by flashlight. "Dear Eula Mae," it began. "I'm somewhere in the Pacific. I can't say where exactly, the censors would black it out anyway. But I wanted you to know I'm thinking about you. The other fellows in my unit found out I have a sister who's a nurse, and now they all want to know if you're pretty and if you have any friends. I told them you're too smart for the lot of them. We had a chaplain come through last week. He talked about loving our enemies and all that Bible stuff Ma used to read us. One of the guys asked him how we're supposed to love the Japs when they're trying to kill us. You know what the chaplain said? He said love doesn't mean letting them win. It means remembering they're human beings even when we have to fight them. It means not becoming monsters ourselves just because we're fighting monsters. I don't know if I'm good enough to live up to that, but I'm trying. Give Mom my love. Stay safe. Your brother, Marcus." Eula Mae folded the letter carefully and held it against her chest. Marcus had always been the thoughtful one, the one who asked hard questions. She wondered what he would think about her situation if he knew about it. The next morning, she returned to Ward C with renewed determination. Captain Brimley was there when she arrived, watching her with cold eyes, but she didn't give him anything to criticize. She was professional, efficient, and maintained perfect emotional distance from every patient. It nearly killed her. When Klaus Meyer tried to thank her for changing his bandages, she simply nodded and moved on. When Otto Schneider asked her a question about his medication schedule, she answered in the briefest terms possible. When young Wilhelm Bauer, the burned patient, whimpered in pain during a dressing change, she finished the procedure without offering a single word of comfort. By the end of her shift, she felt hollowed out. This wasn't nursing. This was just going through the motions, treating bodies instead of people. But it satisfied Captain Brimley, who gave her a curt nod as she left the ward that evening. This pattern continued for 3 more days. Eula Mae arrived, administered care with mechanical precision, and left without forming any human connection with her patients. The German prisoners noticed the change. Some seemed relieved they didn't have to deal with the confusing cognitive dissonance of a black woman treating them with kindness. Others looked almost disappointed. Klaus Meyer was the most affected. His physical condition improved steadily. The infection was clearing and his arm was healing well. But something had gone out of his eyes. He took his medication without complaint, but also without acknowledgement. He was cooperating not because he trusted Eula Mae, but because it was easier than resisting. On the 4th day, everything changed. It started with a new prisoner arriving at Ward C. His name was Hauptmann Friedrich Weber, a captain in the Wehrmacht who had been captured after a fierce battle in France. Weber was in his late 30s, a hardened career soldier with cold eyes and an air of authority that didn't disappear just because he was now a prisoner. He had taken shrapnel in his leg and lower back, serious enough to require surgery but not life-threatening. Dr. Morrison operated successfully and assigned Weber to bed 23 at the far end of the ward. Weber regained consciousness around midday. Eula Mae was making her rounds when she heard him speaking in German, not to anyone in particular, just talking as he came out of the anesthesia fog. She couldn't understand the words, but she recognized the tone. It was the same tone Captain Brimley used, dismissive, superior, cruel. Otto Schneider, whose bed was near Weber's, translated quietly for the other prisoners. Eula Mae caught a few English words in the translation. Inferior, contamination, disgrace. She didn't need a translator to understand that Weber was talking about her. She finished her rounds without acknowledging him. But when she returned with his post-operative medication, Weber was fully conscious and looking at her with undisguised contempt. You, he said in heavily accented English. You are nurse. Yes, I'm Nurse Johnson. This is mistake, Weber said flatly. I request different nurse. I'm the nurse assigned to this ward. If you have medical concerns, I have concern, Weber interrupted. Concern is you, I am German officer, I will not be touched by. He searched for the English word, then settled on one that made Eula Mae's blood run cold. By Untermensch, by subhuman. The ward went completely silent. Even the guards at the door shifted uncomfortably. Eula Mae stood very still, the medication cup in her hand. You need this antibiotic to prevent infection, she said calmly, though her heart was pounding. I'm going to set it here on your bedside table. You can take it or not, that's your choice. I will not take medicine from your hand, Weber said. He turned his head away from her in a gesture of absolute dismissal. Eula Mae set the cup down and moved on to the next patient. But Weber wasn't finished. This is what America is, he announced to the ward in English, clearly wanting his fellow prisoners to understand. They put inferior races in position over superior ones. They mix what should not be mixed. This is why they will lose. This is why the Reich will triumph. They have forgotten the natural order. Eula Mae kept walking, kept doing her job, kept her face neutral. But inside, she felt something breaking. This was different from Captain Brimley's racism. Brimley was a product of the American South, with all its twisted history and inherited prejudices. But this was the ideology her brothers were fighting against. This was the belief system that had started a war that was killing millions, and she was supposed to provide medical care to a man who thought she was subhuman. She finished her rounds and went to Dr. Morrison's office. I need to talk to you about Captain Weber, she said. Dr. Morrison looked up from his paperwork. I heard what he said, Eula Mae, I'm sorry. Can you assign him a different nurse? Morrison shook his head slowly. I wish I could, but there are only 2 nurses trained to handle post-operative care in this facility, you and Nurse Henderson. Henderson is on leave for the next 2 weeks. Her father passed away, so unless we want to transfer Weber to the main hospital, which Captain Brimley has already vetoed for security reasons, you're it. He refuses to take medication from me. Then he'll suffer for his prejudice. That's his choice. Morrison's expression softened. Look, I know this is asking a lot, but you're the professional here. He's just a wounded prisoner who's scared and angry and clinging to a dying ideology. You're the one with the power in this situation, not him. Eula Mae wanted to laugh at that. Power. In 1944, Louisiana, as a black woman, she had no power. She couldn't vote. She couldn't eat in the same restaurants as white people. She had to use separate water fountains and sit in the back of buses. The German prisoners in her ward had more legal rights than she did. But Morrison was right about one thing. In the context of Ward C and the relationship between nurse and patient, she had the knowledge and skills that Weber needed to survive. "I'll do my job," she said finally. "But I need you to document his refusal to take medication. If his condition worsens because of his own choices, I want that on record." Fair enough. For the next 3 days, Friedrich Weber refused to take any medication that Eula Mae offered. His fellow prisoners watched this standoff with varying reactions. Some, like Klaus Meyer, seemed troubled by it. Others appeared to admire Weber's principles. By the 3rd day, Weber was in significant pain. The surgery site was starting to show signs of inflammation, not quite infection yet, but heading in that direction. He was also running a low-grade fever. Dr. Morrison examined him and made a note in his chart. "Captain Weber, if you don't start taking your antibiotics, you're going to develop an infection. That infection could spread to your bloodstream. Sepsis can kill you." "Then find me proper nurse," Weber said through gritted teeth. "Nurse Johnson is a proper nurse. She's qualified, skilled, and trying to save your life." "She is nothing," Weber spat. "Less than nothing." Eula Mae stood by the nursing station, organizing medication trays for her other patients. She could hear every word, but she didn't react. She had learned long ago that showing emotion only gave men like Weber what they wanted. That night, she sat in the colored nurse's quarters with Bessie, who had brought her a cup of coffee. "You holding up?" Bessie asked. "I don't know," Eula Mae admitted. "I keep thinking about my brothers fighting men who believe exactly what Weber believes. And here I am supposed to save his life. How does that make any sense?" "It doesn't have to make sense," Bessie said gently. "It just has to be right. What if I just stopped? What if I let him refuse medication and documented it and let nature take its course?" "You could do that," Bessie said. "It would be within your rights. He's making an informed choice to refuse treatment. But would you be able to live with it?" Eula Mae thought about that question for a long time. The next morning, when she arrived at Ward C, she found Klaus Meyer waiting near the nursing station. The young German soldier looked agitated. "Nurse Johnson," he said quietly, "I must speak with you." "About what, Private Meyer?" "About Hauptmann Weber, please." Klaus glanced toward Weber's bed at the far end of the ward. "What he says, what he believes, not all of us believe this." "I appreciate that, Private Meyer, but you saved my life," Klaus interrupted, his English halting but earnest. "When I come here, I was sick, infected. You could have done nothing. Let me die. I was enemy, but you healed me anyway. Why?" It was the same question he had asked before, but this time the context was different. This time there was desperation in his voice. "Because it's my job," Eula Mae said. "No," Klaus shook his head vehemently. "Is more than job. You sit with me. You talk about your brother. You help me write letter to my mother. You treat me like human being, even though I am enemy, even though." He struggled for words. "Even though men who look like me, they would not treat you like human being." Eula Mae looked at this young German soldier, barely older than her youngest brother, and saw something in his eyes she hadn't expected: shame. "Private Meyer, I was in Hitler Youth," Klaus said quietly, the words tumbling out as if he'd been holding them back for too long. "Since I was 10 years old, they teach us. They teach us so many lies, about races, about who is superior, about who deserves to live." His voice dropped to barely a whisper. "They teach us people like you are not fully human, and I believed them. God help me, I believed them." A tear rolled down his cheek. Several other German prisoners were listening now, though pretending not to. "But then I come here," Klaus continued, "and the first person who treats me like human being is person I was taught to despise. You show me mercy when you have every reason to hate me. You heal me when you could let me suffer. And I understand that everything they taught me was lie." He wiped his eyes roughly. "Hauptmann Weber, he still believes the lies, but maybe if he sees what I have seen, maybe he can learn too. Please do not give up on him. Please do not become hard like he is hard, because if you do, then the lies win." Eula Mae felt tears stinging her own eyes now. She had been so focused on maintaining professional distance, on protecting herself from more hurt, that she had forgotten the real reason she had become a nurse in the first place. "Thank you, Private Meyer," she said softly. That means more than you know." She approached Weber's bed with renewed purpose. The German captain was lying with his eyes closed, his face pale and sweaty. The fever had gotten worse overnight. "Captain Weber," she said. I'm going to change your surgical dressing now. Weber opened his eyes. I told you not to touch me, and I'm telling you that your wound needs to be cleaned and redressed or you will develop a serious infection. Now you can cooperate or I can have the guards hold you down while I do my job. Your choice. For the first time, Weber seemed to realize that his position was not as strong as he thought. He was a prisoner, wounded in a foreign country. His ideology meant nothing here. Fine, he muttered. Do what you must. Eula Mae pulled back the bedding and carefully removed the old dressing. The surgical site looked angry and inflamed. It wasn't infected yet, but it was close. She cleaned it thoroughly, applied antibiotic ointment, and placed a fresh dressing. Weber hissed in pain but didn't pull away. You need to start taking your antibiotics, Eula Mae said as she worked. This inflammation will turn into an infection if you don't, and that infection will turn into sepsis. Sepsis will kill you slowly and painfully. Why do you care? Weber asked bitterly. I am enemy, I am what you Americans say, Nazi, you should want me to die. Eula Mae finished securing the dressing before she answered. When she spoke, her voice was quiet but firm. My youngest brother is fighting in the Pacific right now, she said. He's fighting against men who believe they're superior because of their race. My other brothers fought in Europe against men who believe the same thing. They're risking their lives to stop that ideology from spreading. She met Weber's eyes directly. If I let you die because of your hatred, because of your belief that I'm inferior, then I'm letting that ideology win. I'm proving that it can make me into something less than what I am. But if I save your life despite your hatred, if I treat you with the humanity you refuse to recognize in me, then I prove that ideology wrong. I prove that mercy is stronger than hate. That's why I care. Weber stared at her, something flickering in his expression that might have been confusion or the first crack in his certainty. So, Eula Mae continued, picking up the medication cup from his bedside table, you can take these antibiotics and live, or you can cling to your hatred and die, but either way, I've done my job. The choice is yours. She set the medication cup back down and walked away. For the rest of the day, the cup sat untouched on Weber's bedside table. Eula Mae made her rounds, cared for her other patients, and didn't mention it again. Klaus Meyer watched anxiously. Several other prisoners whispered among themselves in German. As evening approached and Eula Mae was preparing to end her shift, she heard movement from Weber's bed. She didn't turn around, didn't acknowledge it. But out of the corner of her eye, she saw him reach for the medication cup. He stared at it for a long moment. Then, with a grimace that could have been pain or shame or both, he swallowed the pills. The next morning, Weber's fever had begun to subside. The inflammation at his surgical site had stabilized. When Eula Mae came to check his dressing, he didn't protest. He didn't thank her either, but he didn't turn away. This pattern continued for the next week. Eula Mae provided care. Weber accepted it with silent resentment that slowly, almost imperceptibly, began to soften into something like grudging acceptance. Meanwhile, something was changing in Ward C. Klaus Meyer had started teaching some of the other prisoners basic English phrases. Otto Schneider, the middle-aged sergeant, began asking Eula Mae questions about America, real questions, not hostile ones. Even the more resistant prisoners began to treat her with a wary respect. Then came the day that changed everything. It was a Tuesday morning, 3 weeks after Weber's arrival. Eula Mae was in the supply closet when she heard shouting from the ward. She rushed out to find chaos. Wilhelm Bauer, the young soldier with severe burns, was having some kind of attack. His whole body was convulsing and his breathing had become labored and irregular. The guards were frozen, unsure what to do. Eula Mae ran to his bedside. "Get Dr. Morrison," she shouted to one of the guards. "Now." She checked Bauer's airway partially blocked. She positioned him on his side to prevent aspiration and checked his vital signs. His pulse was racing and his skin was turning blue around his lips. "He's going into respiratory distress," she said to no one in particular. She grabbed her medical bag and pulled out a respiratory stimulant, administering it quickly. "Come on, Wilhelm, breathe, breathe." The other prisoners watched in stunned silence as Eula Mae worked. Her hands moved with swift, practiced efficiency, tilting Bauer's head to maintain his airway, monitoring his pulse, administering oxygen from the portable tank she'd brought to his bedside. "Breathe," she kept saying, her voice calm and steady even though her heart was pounding. "That's it, nice and slow, breathe." Dr. Morrison arrived and immediately assessed the situation. "Respiratory crisis, possible reaction to the new antibiotic we started yesterday. I've given him a respiratory stimulant," Eula Mae reported, still maintaining Bauer's airway. "Oxygen at 4 liters, pulse is 142 and thready." Morrison listened to Bauer's lungs. "Good call on the positioning. Let's try epinephrine 0.3 milligrams." Eula Mae prepared the injection while maintaining her position. It was a delicate maneuver that required both skill and steady hands. She administered the epinephrine and continued monitoring Bauer's vital signs. Slowly, agonizingly slowly, Bauer's breathing began to stabilize. His color improved. His pulse rate started to come down. After what felt like an eternity but was probably only 10 minutes, he was breathing normally again. "You saved his life," Dr. Morrison said quietly to Eula Mae. "If you hadn't acted that quickly, he would have died." Eula Mae was still holding Wilhelm Bauer's hand, monitoring his pulse. "He's somebody's son," she said, echoing the words she had spoken to Klaus Meyer weeks ago. She looked up and found every person in the ward staring at her prisoners, guards, Dr. Morrison. In that moment, she hadn't been a black nurse or a woman or a colored person who should remember her place. She had simply been a skilled professional saving a life. And everyone in that room had seen it. After her shift ended, Eula Mae was walking out of Ward C when she heard someone call her name. She turned to find Friedrich Weber standing at his bedside. He had progressed to the point where he could walk with crutches, though he still tired easily. "Nurse Johnson," he said stiffly. "Yes, Captain Weber." He looked at her for a long moment, struggling with something internal. When he finally spoke, the words seemed to cost him enormous effort. "What you did today for Private Bauer, that was—" He paused, searching for words in English. "That was the action of a skilled physician. No, a skilled healer." It wasn't quite an apology. It wasn't quite an acknowledgement of her humanity. But from a man who had called her subhuman just weeks ago, it was something. "Thank you," Eula Mae said simply. Weber nodded once curtly and returned to his bed. But as Eula Mae left the ward, she saw him say something to Klaus Meyer in German. Klaus's face broke into a wide smile, and he looked at Eula Mae with an expression of pure hope. Now back to where we started. 6 hours after saving Wilhelm Bauer's life, Eula Mae was once again facing Captain Brimley in the doorway of Ward C. "You have no business being in this ward, nurse. These are enemy prisoners, not patients deserving of your kindness. Every man bleeding on a hospital bed is my patient, Captain. That's what the Hippocratic Oath means." But this time, the confrontation played out differently. Because this time, Eula Mae had witnesses. Before Captain Brimley could order her removed, Klaus Meyer stood up from his bed. His arm was still bandaged, but he was strong enough now to stand. "Captain," Klaus said in carefully practiced English, "Nurse Johnson saved my life. She saved Wilhelm Bauer's life today. She is good nurse, the best nurse." Otto Schneider stood next. Then Franz Vogel. Then one by one, every prisoner in Ward C who was capable of standing rose to their feet. "She heals us," Otto said in his heavily accented English. "She treats us like human beings." Even Friedrich Weber, leaning heavily on his crutches, stood at the end of his bed. "This nurse," Weber said slowly, each word clearly difficult for him, "has shown more honor, more professional skill than many officers I have served with. She has fulfilled the duties of a healer beyond question." Captain Brimley stared at the ward full of standing German prisoners, his face turning red. "You men sit down. This is not a democracy. You don't get a vote." "Actually, Captain," Dr. Morrison said, stepping forward from his office, "they kind of do. Because if Nurse Johnson is removed from this ward, I will officially document that Ward C is understaffed and unable to provide adequate medical care. And according to the Geneva Convention, that means these prisoners would need to be transferred to a facility that can provide proper care. Which would be a lot of paperwork for you to explain to your superiors." "Are you threatening me, doctor?" "I'm explaining the medical requirements, Captain. Nurse Johnson is the only nurse trained and available to provide the specialized care these patients need. Remove her and you create a Geneva Convention violation. Is that really what you want on your record?" Brimley looked from Morrison to the standing prisoners to Eula Mae. His hands clenched into fists at his sides. "Fine," he bit out. "But I'm filing a report about this, about all of this." "You do that," Morrison said mildly. "I'll be filing one too, about how Nurse Johnson saved Private Bauer's life this morning through quick thinking and excellent medical skills. I'm sure both reports will be very interesting to the brass." Brimley stormed out of the ward, his MPs trailing behind him. As soon as he was gone, the prisoners sat back down, many of them grinning despite themselves. Eula Mae found that she was shaking. "You didn't have to do that," she said to Klaus. "Yes," the young German said firmly. "We did. You showed us mercy. Now we show you what is word, respect." "Respect," Eula Mae confirmed, her eyes stinging with tears she refused to let fall. The weeks that followed brought gradual changes toward C. Captain Brimley did file his report, but it went nowhere. Head Nurse Patterson filed her own report praising Eula Mae's work, and Dr. Morrison's account of Bauer's medical emergency made it clear that she was indispensable. The German prisoners continued to heal, and many of them began the long psychological journey of questioning what they had been taught. Klaus Meyer wrote letters to his mother describing the black nurse who had saved his life and treated him with kindness. Otto Schneider started reading American newspapers, trying to understand this confusing country where racial prejudice existed alongside genuine mercy. Friedrich Weber never apologized outright for calling Eula Mae subhuman. But one day, about a month after the confrontation with Brimley, he stopped her as she was checking his surgical site. "In Germany," he said quietly, "I was taught that certain people were inferior, that this was scientific fact, not opinion." He paused, staring at his hands. "But science requires evidence, and the evidence I have seen here, it contradicts everything I was taught." "Yes," Eula Mae said gently, "it does. This is difficult to accept." "I imagine it is." Weber was silent for a moment. "My daughter is 8 years old. She is in Hitler Youth now, learning the same lies I learned. When I return to Germany after the war, I will tell her different stories. I will tell her about the nurse who saved my life even though I did not deserve her mercy." It was the closest thing to repentance Eula Mae would ever receive from him, and she accepted it. In November 1944, Eula Mae received a telegram. Her hands shook as she opened it, terrified of what it might say. But it was good news. Her brother Thomas had recovered enough to be discharged from the hospital. He was coming home. She received another letter from Marcus a week later. He was safe, still in the Pacific, but safe. And Samuel had writ to say his unit was pushing through France, making progress, hoping the war would end soon. The war in Europe did end in May 1945. By then, most of the German prisoners in Ward C had healed enough to be transferred to regular POW camps. Klaus Meyer was among the last to leave. On his final day, he approached Eula Mae with a small wooden carving he had made during his recovery, a simple cross, smoothed and polished. "My grandfather was carpenter," he explained in much improved English. "He taught me to carve when I was small. I make this for you to say thank you and to remember." "Remember what?" Eula Mae asked. "To remember that mercy is stronger than hate," Klaus said, repeating the words she had spoken to Weber. "You taught me this. I will never forget." He shook her hand, a gesture that still drew stares from some of the white staff, a black woman and a white man shaking hands as equals, and then he was gone. Friedrich Weber left a few days later. He didn't say goodbye, but he left a note on his bed for Eula Mae to find. In careful English, it read, "You were right. I was wrong. I am sorry I had to come to America as a prisoner to learn this lesson. Perhaps some good can come from war after all." F. Weber, when the war ended completely in August 1945, Eula Mae's 3 brothers came home safe. She met them at the train station in Hattiesburg, Mississippi, and they held each other and cried with relief and joy. Marcus noticed the wooden cross she wore on a chain around her neck. "Where did you get that?" he asked. So Eula Mae told them the whole story about Ward C and the German prisoners and Captain Brimley and Klaus Meyer and Friedrich Weber and the moment when all those men had stood up for her. When she finished, Samuel was quiet for a long time. "We were fighting against everything those men believed in," he said finally, "and you defeated that ideology by showing them mercy, by being the person they were taught you couldn't be." "I was just doing my job," Eula Mae said. "No," Thomas said. "You were doing something more important than that. You were proving that our side was right, not just about the war, but about what it means to be human." Marcus, always the philosophical one, smiled. "Remember what that chaplain told us, about not becoming monsters while fighting monsters. You showed those men what that looks like." The story of Eula Mae Johnson and Ward C became a quiet legend at Camp Ruston. It wasn't the kind of story that made national headlines. In 1944 and 1945, America wasn't ready to celebrate a black woman's triumph over both Nazi ideology and American racism. The official reports documented her medical skill, but glossed over the deeper significance of what had happened. But the people who were there remembered. Dr. Morrison told the story to his colleagues. The guards who witnessed the confrontation with Captain Brimley told their families. Bessie Wright told every new colored nurse who came to work at the camp, "Let me tell you about Eula Mae Johnson and what real nursing looks like." And across the ocean, in a devastated Germany trying to rebuild itself from the ashes of the Third Reich, Klaus Meyer kept his promise. He told his mother about the black nurse who had saved his life. He told his friends and neighbors. And years later, when he had children of his own, he told them about Nurse Johnson and the lesson she had taught him about mercy and humanity. Friedrich Weber, true to his word, told his daughter different stories than the ones he had learned in his youth. He taught her that propaganda lies, that ideology can blind you to truth, and that sometimes the people you're taught to despise are the ones who end up saving your life. Eula Mae Johnson continued nursing for another 30 years. She worked in hospitals throughout the South during the Civil Rights era, treating patients of all races with the same professional skill and human compassion she had shown to those German prisoners. She marched with Dr. King in Selma. She registered voters in Mississippi. She lived to see the Civil Rights Act passed, to see the world slowly, painfully change. She never forgot Ward C. She kept Klaus Meyer's wooden cross her entire life, and she kept the note from Friedrich Weber folded in her Bible. Sometimes, when the struggle for equality seemed impossibly hard, when she faced hatred and discrimination that made her want to give up, she would read that note and remember. Remember that minds could change. That ideology could be defeated not with weapons, but with mercy. That showing humanity to those who deny your humanity is not weakness. It is the strongest thing a person can do. In 1975, 30 years after the war ended, Eula Mae received a letter from Germany. It was from Klaus Meyer, now a grandfather himself, writing to tell her that he had never forgotten her kindness. He enclosed a photograph of his grandchildren and a message. "I taught my children what you taught me. Now I teach my grandchildren. The mercy you showed me has rippled through 3 generations. Thank you." Eula Mae showed the letter to her own grandchildren. "This," she told them, "is why we choose mercy over hatred, not because people deserve it, but because we do. Because when we respond to hatred with humanity, we change the world one heart at a time." Her granddaughter, who was studying to be a nurse herself, asked, "But wasn't it hard? Weren't you angry at them for what they believed?" "Of course I was angry," Eula Mae said. "Anger at injustice is natural and right, but I had to choose what to do with that anger. I could let it make me bitter and hard, or I could use it to fuel something better. I chose to prove them wrong not by arguing with their ideology, but by being exactly the person they claimed couldn't exist." "Did it work?" Eula Mae smiled and held up Klaus's letter. "Some of them learned. Not all Friedrich Weber still struggled with his prejudices until the day he died, but some of them learned, and they taught others, and those others taught more. That's how change happens, not all at once, but one transformed heart at a time." When Eula Mae Johnson died in 1998 at the age of 82, her obituary in the local paper mentioned her long career as a nurse and her work during the Civil Rights Movement. It didn't mention Ward C. or the German prisoners. That story was too complex, too nuanced for a brief obituary. But at her funeral, her daughter read from Klaus Meyer's letter. And she read from a more recent letter that had arrived just months before Eula Mae's death, a letter from Friedrich Weber's daughter, now an old woman herself, writing to thank the nurse who had shown her father mercy and in doing so had changed the trajectory of their entire family. "My father was not a good man when he went to America," the letter read. "He believed terrible things. He did terrible things in service of a terrible ideology. But your mother showed him mercy anyway. She cared for him anyway, and that mercy planted a seed of doubt in his certainty. That doubt grew into questions. Those questions led him to renounce everything he had believed in. He spent the rest of his life trying to make amends for his role in the war. He never fully succeeded, how could he? But he tried. And he raised me to be better than he was, and I raised my children to be better still. All because a black nurse in Louisiana showed mercy to a man who called her subhuman. Please tell your mother that she changed more than one man's life. She changed a family tree. She changed a legacy. That is the power of mercy." The story of Eula Mae Johnson and Ward C. reminds us of a profound truth, that our humanity is defined not by how we treat those who respect us, but by how we treat those who don't. That mercy is not weakness, but strength. That choosing compassion over hatred, even when hatred seems easier or more justified, is how we change the world. In a time of war, in a place where both Nazi ideology and American racism denied her humanity, Eula Mae Johnson proved that one person's choice to show mercy could ripple out across generations and continents. She proved that ideology, no matter how entrenched, could be defeated by simple human kindness. She proved that the arc of the moral universe, as Dr. King would later say, bends toward justice. But it bends because of people who choose mercy over vengeance, compassion over cruelty, hope over hatred. That is the legacy of Eula Mae Johnson. That is the lesson of Ward C., and that is why 80 years later we still tell this story, because the choice between mercy and hatred is one every generation must make. And Eula Mae showed us which choice leads to redemption. Thank you for listening. If this story touched you, please subscribe and share your thoughts in the comments.